When people are in an acute situation, and it's going to be very personalized, the first thing to do is to check the ketone level and see, well, are the ketones lower? If the ketones have been lower, then the very first thing that I would do is adjust the diet to bring the ketones into a higher range.
It's not so black and white whether someone is stable from the ketogenic diet, or is it other things that they're doing. I do have people who have been on the diet for a number of months, and it seems to be a really helpful tool for them, but they're still taking psychiatric medications. They haven't tapered off of them yet, and they've had mood episodes or relapses in their symptoms. So it is possible. I mean, I don't think people should think of this as, well, now I'm in ketosis and I'm protected no matter what, as long as I stay in ketosis. I don't think that's a realistic point of view. There's no treatment out there that can protect us from all eventualities. You know, if the right type of stress hits us, whether it be a psychological stress or environmental stress or a biological stress, things can happen. And so I think it's important to be realistic. This is a powerful treatment, but it doesn't make us bulletproof from all eventualities in life. So again, part of this idea of expecting the unexpected, preparing for the challenges ahead, knowing that they're going to happen, and we'll do our best to get through them, and we're going to learn something whenever we get through these challenging times. And I think, having that healthcare proxy could help. I think having it all out in writing could help quite a bit. This has been my care plan. This is when I instituted it. This is how I was able to reduce or taper off of medications. This is the most stable period I've had in all these years. It's highly attributable to these practices, ketogenic diet, and every other practice, whether it be exercise, meditation, sleep regimens, whatever else is part of that plan should be all written out. And, this is what I would like to continue to adhere to, even if in the event that I have a crisis. And it's not unreasonable to be open to temporarily using medications potentially in a really acute crisis as well. And so writing out one's thoughts about that or wishes about that, if I was going to need a medication, this is the one that I would prefer because this and this and this, whether it be I've tried this one before, it was helpful, or this one was extremely unhelpful. I really would rather not be on this medication. I think it's almost like the way, when women are pregnant, they write out a birthing plan, with all the details, as many details as possible about how they want it to go. And it doesn't mean it's going to go exactly that way, but it's really helpful to have a document in writing for, that person, their support network, but the whole care team as well should read that. And in my general sense is that in that setting, the care team does read it. And I would expect the same on an inpatient psychiatric unit. The most important criteria is that it's a really trustworthy person, or someone that person truly trusts. And even in a crisis, that it's still going to feel like a trustworthy person. Now, there are some types of crises where everyone becomes untrustworthy. It's part of the crisis. But still, I mean, the most trustworthy person in one's life, I think, and that can often be a family member. It does not have to be someone outside the family. In fact, I think more typically healthcare proxies are family members. Sometimes in the beginning, when someone's first getting into a metabolic treatment, we do shoot for higher levels of ketones, to get some more rapid benefits. And I think sometimes we do get more rapid benefits with higher, levels. And so let's say someone's average ketone level is, 1.5, and they fluctuate somewhere between 1 and 2, typically averaging 1.5. And, they're noticing that things are, symptoms are coming back. It's very reasonable to try to, tighten up the program dietary and exercise wise to try to shoot for some higher levels of ketosis and see if that helps, prevent the crisis. I think once a crisis is going, I don't think we have any evidence to show that, let's get the ketones up to 3 or 4 and that's going to resolve the crisis on its own. I think, we just don't have evidence that is going to happen. Doesn't mean it wouldn't. It's reasonable to try, but I wouldn't expect that, I'll just get my ketones to 4 and my crisis will resolve just from that. In terms of preparation, Ellenhorn developed this document called the SACT, Shared Agreement for Collaborative Treatment. And it's really like a questionnaire that we ask our clients. In the first few weeks, when someone's with us, one of the clinicians will go through these questions with our clients. And it's really helpful for helping us as a care team prepare for crises and then just in general know someone's preferences in advance. So I'll go through it now. So first section is experiences with help. So first question is, overall in treatment, what has been the most helpful? Second question is, what's been the most harmful or hurtful? Third question, what are important things we should know about you as far as how you might use or avoid help and support in the midst of a challenging situation? And the fourth question is, are there any particular experiences that stand out to you about the way you've been treated by helpers, either good or bad experiences? The second section is about signs and symptoms. So first question there is, who is the first to notice when symptoms are worsening? Is it a family member, a friend, treatment providers, or you as the individual? And what's the usual response from the person who's noticing this? Second question, what does it look like when symptoms are worsening or when things are breaking down? Third question, what are indicators that you need a higher level of care or any kind of increased support? And the fourth question is, what might be the signs that a crisis has passed or that things are improving? What should we be looking for? And then third section is, what are the helpful responses from clinicians? What do you want us as clinicians to say or do when things are falling apart? What would not be helpful for us to say or do in those situations? Are there any other people that it would be helpful for us to involve in the situation, in your crisis? And then how do we most effectively discuss our concerns to you if we have concerns that things are moving into a crisis phase? How should we address you or present that to you if that's happening?
There's some great resources that come from the epilepsy world. So Matthew's friends, if you go to their website and you type in hospitalization, they have some wonderful resources that kind of talk about like what types of IVs are appropriate in those situations. And there's also, I was contacted just recently by someone who was put on a feeding tube and needed blender meals, so to speak. If there's something really bad going on and suddenly someone can't eat a ketogenic diet, for example, there are Charlie's Foundation has a wonderful blender meals cookbook that you can download that's very reasonably priced, and a family member can create these blender meals that can then be put in. So if you can't orally eat, there's recipes that you can download and use and prepare that can be taken to the hospital or even at home, can feed someone who needs to stay on a ketogenic diet but isn't able to eat orally. If you do know that you're going to be hospitalized, like maybe with a surgery or something like that, I think that planning ahead and getting things like keto bricks, maybe keto meal replacements ahead of time figured out, talking to the hospital, asking if there's going to be a small refrigerator in the room. Often there is. And keeping heavy cream or whatever your fat sources are. The hospital they go to really just has a lot of power over what their meals look like. So I have worked with people who were hospitalized after the implementation of a ketogenic diet, and they were early in their ketogenic diet, and they went to hospital, and some of them were able to request ketogenic-like foods, although that can be very difficult in a hospital setting because they make so many others available. And then I've had people who've had family members that have made their food and brought it in for them every day and through the week, which I always thought was just such a huge act of love to just work so hard for them to keep them on the diet so that they could recover better. I've heard other metabolic psychiatrists talk about higher ketone levels might be needed for stabilization. And in the case study research literature, for example, there was someone who was stabilized on the diet, went off of the diet, became psychotic, and they actually fasted her to get her into a deep level of ketosis. And so I think that my intuition would be that it would be good to have a higher ketone level. And so if someone has been on maintenance at a 1-to-1 or a 1.5-to-1 ratio, it might be time to up it if they have that type of support.
Yeah, so when people find themselves in the hospital, whether it's for a mental health reason or a physical health reason, and they're trying to stay on a ketogenic diet, it can be very challenging. There's no question about it. But there are definitely strategies that you can use, and it will help to prepare in advance if you can. Sometimes we end up in the hospital without any warning, and so that's a different story. But any of us could end up in the hospital without warning if we're in a car accident or something happens, right? So there are certain things you can do if you're going to be in the hospital. So one is, there's a lot of hospital food, which is absolutely incredibly unhealthy, but that doesn't mean you have to eat everything that's brought to you. So if you ask for the hospital menu in advance and see, okay, which foods on that menu might actually fit into your plan. So you might be able to, for example, you might be able to eat the chicken or the burger or the piece of ham or whatever it is that's or the egg that's on the plate, and there might be if you're lucky, maybe some non-starchy vegetable, maybe a healthy source of fat, and then set everything else aside. You can request extra butter if you eat dairy. You can bring your own sources of fat. Whatever source of fat you prefer to add to meals will be very helpful, because a lot of the hospital menu food will be too low in fat and too high in carbohydrate. So adding some extra fat can be useful. Another thing you can do, so this could be, for example, you could bring to the hospital a bottle of olive oil or some coconut oil, or if you're using non-dairy animal fats that are going to need to be refrigerated, most hospitals will allow you to keep some of your own food in their refrigerator on the unit. But this is, for example, might be duck fat or tallow or some healthy mayonnaise without seed oils that you have from home or that you've purchased, or even sugar-free vinaigrette. There are some hospitals now, it's not most, but there are some hospitals where they actually allow outside food delivery from food delivery services like DoorDash or Uber Eats. And so if that's an option, you can then have really a tremendous amount of control over what you eat. But many units still do not allow that. But what is almost always allowed is for a family member or a friend to bring you the food of your choice. And this has been really a lifesaver for so many of my patients when they find themselves in the hospital for whatever reason. If their partner or their friend can bring their food every day or every other day, just enough to keep in the refrigerator, that is really the ideal scenario if you've got somebody like that in your life. Another strategy you can use, unless you're underweight or at risk of being underweight, is to simply eat less frequently. You still want to avoid the carbohydrates that are in whatever's delivered to you from the kitchen at the hospital or from outside the hospital. So you still want to limit your carbohydrate, but you may, if there isn't something on the menu for lunch that day that works for you, you could skip a meal. So you could do some intermittent fasting and just eat less, which again, unless you're underweight or at risk of underweight, this will support the healing process. With whatever issue has brought you into the hospital, it can be very helpful to fast more frequently while you're in the hospital. Bring those insulin levels down, those glucose levels down. It's naturally anti-inflammatory. You've got the least amount of inflammation, the least amount of oxidative stress, and the lowest glucose and insulin levels when you are not eating anything at all. And this is why so many hospital procedures require that you don't eat anything for you. It's called NPO, nothing by mouth, nothing per, I think Latin is something like nothing per orum or something like that. Doctors are very familiar with writing NPO orders for patients. And you can kind of write your own NPO order that, I'm just going to eat once a day, or I'm only going to eat when the food suits, when the food works for me. It can also be really helpful to share your dietary needs with the hospital care team. And even if you're, for example, if you're being hospitalized for a psychiatric reason and you're assigned to a room where you have a roommate, depending on, the circumstances, to even share your dietary needs with your roommate as well, so that people around you have the opportunity to support you. Not everyone is going to support you, but some people might. And ketogenic diets are becoming more familiar to people. And some people, and especially if you share that you've had a positive experience and it's really supported your good mental health, you may find allies in the hospital that can support you and help keep you on track. Because when you're under stress in an unfamiliar environment, especially in the hospital, which can be so stressful, it may be hard, even if you have the right foods, it may be harder to stick to your plan. You may be tempted. You're going to be surrounded by opportunities to eat things that are really unhealthy. And so it can be helped to have a few other people around you to help you stay accountable and true to your goals. If you're going to have surgery or a procedure, is to request that there's no glucose or dextrose in the IV fluid because you're on a ketogenic diet. And there are very few situations, medical situations, where the glucose or dextrose would be necessary. So most physicians are willing to make that accommodation. The last thing I would suggest is, if you're being started on any new medicines in the hospital, especially if they're liquid medications, there are liquid medicines. Most liquid medicines are sweetened with sugar. And so if you're being started on a new medicine and it's in a liquid form especially, you may want to request that medicine be switched to a tablet or a capsule instead of the liquid. When people are in an acute situation, especially psychosis, what exactly the right thing is to do in that situation from a dietary standpoint. It really depends on the circumstances. And it's going to be very personalized. At least this is how I work. So the first thing I would do is check the ketone patterns and see, has, for whatever reason, have the ketone levels been falling? Have they been trending down? And so that would be the first thing to do. If the person has a history of psychosis, they've been doing well on a ketogenic diet, but then some of the psychotic symptoms begin to return, the first thing to do is to check the ketone level and see, well, are the ketones lower? Could it be that there isn't as much metabolic protection as there had been recently? And then if that's the case, if the ketones have been lower, then the very first thing that I would do is adjust the diet to bring the ketones into a higher range. Being in ketosis is a very important protective factor in good mental health, but it's not the only factor in the diet. So because inflammation and oxidative stress and food sensitivities and other kinds of things can play a role in good mental health. So you might still be in ketosis, but what if you started eating something that you hadn't really been eating a lot of before, that you're either sensitive to or is causing inflammation or is aggravating your immune system? Then there may be a dietary culprit that has nothing to do with your ketone levels. So I do always ask about that. And something else, sometimes it can be a seasonal shift. This has happened to me in clinical practice several times, where somebody with mental illness will be doing so much better on a ketogenic diet for a long period of time, to the extent that we're able to gradually start lowering the medication that they're taking to treat the psychosis, and they do quite well for a while, and then something happens. It could be that they get sick, or there's an injury. It could be that the season changes and they're particularly vulnerable during a particular time of year. And with less medication and the combination of less medication and the season, it just wasn't, we don't have enough protection during that period of time. So there are other factors besides the ketones that can change what the person is experiencing. Illness and injury are very common causes of relapse, even when a person is in ketosis on a ketogenic diet and they've been doing well up to a certain point. So there are other factors to look at, stress, sleep patterns, exercise patterns, all kinds of other things beyond the ketones. But the ketones are that's the first place I always look, because that's one of the most powerful levers that you can pull.
Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.